Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes once again. So we'll wait for some minute to join all the aspirants to the live session. So we'll start the class, right? In the last previous class, we have discussed the most important core concept where by holding the one particular question, I have given you a thousand points that is much necessary and which is most important for your upcoming RRB Nursing Superintendent exams and Norcet 8 mains exams. Students, whatever the golden point I am delivering, don't neglect the thing because this thing is the most important thing. Only a selected content from here the question is rising. From here the you people are making mistake. That one I am selecting and I am making it very clear. Okay, by differentiating the things very easily, right? So all you people have to do is to completely involve in the rapid revision. Okay, so here I am repeatedly telling some words, some important words. I will repeat at least two times, three times. So those kind of the words is most important words. Okay, so that one you people have also at least revise two times. Okay, because it will directly strikes in the your mains exam and RB nursing superintendent exam, right? So very good evening, beta. Good evening. Very good evening. Welcome once again everyone to the master nursing classes. So if everyone is okay with thing, we will start the class, right? So good evening, beta. Good evening. A very good evening. Okay. So we'll start the class. And before going to the main very important class, here's a beautiful motivational quote for you people. Bacho, this is the time to be completely be focused. Okay. I know some of you are stuck after giving the prelims exam. You are having feeling some low confidence that whether I will get select in the prelims or not. So this is not a time to think much. This is a time to take actions. Okay. I am repeatedly telling definitely you will get qualified for the prelims. If not, keep continuing study and it will help to the RRB nursing superintendent exams. So I am repeatedly telling and make a one thing clear in your mind. You are wasting the time means you will get lost both things. RRB also, Norcet also. So if you are keeping continuous preparation means both thing you will get. RRB nursing superintendent exam also will crack. Norcet mains exam also will crack. Okay, wherever it is near to you, you can go join. You can go and join there. Okay, so this is the time to be completely focused. Okay, so if you want to reach your designated goal, means you have to sacrifice the thing very badly. Okay, so yes, you have to be completely focused. You have to be completely passionate towards your goal. Okay, so then only the something will comes in your hand. Okay, so we'll start our today's class with a beautiful motivational quote, and here's the first question in front of you people. Okay, so do read the question completely till the end and try to give the best answer to every questions. Okay, so here is the question in front of you people. So for do read the question, then try to give the best answer. Right, the question is a 5-year-old child is admitted to the pediatric ward. Okay, so what happened here, the 5-year-old child is there and the child is admitted to the pediatric ward. Okay, with a high fever. Okay, and the nurse inserts the rectal thermometer. Okay, what happening here, the nursing officer checking the temperature and she inserts the rectal thermometer in the rectum of the patient. Okay, so ideal length of insertion of the rectal thermometer is the, yes, how much, that is the 1.5 to 2.5 inches. Okay, we have to insert in the anal sphincter. So nurse is now she inserted the rectal thermometer. Okay, to obtain the accurate core body temperature. And remember the one more important. So best route of assessing the accurate core body temperature is the rectal route. Okay, most reliable route of assessing the core body temperature is also a rectal route. Most commonly used one is the axillary route. Okay, most preferred and frequently used in the hospital is the axillary route. Okay, least important is the axillary route. Okay, so these are the important points. It will comes in your exams. Okay, so what is the difference between the oral temperature and a rectal temperature? Means a 1 degree Fahrenheit. Okay, so a accurate route of assessing the temperature as a core body is the rectal route. I have told you already. Okay, so these are the very frequently asked questions. It will come. Okay, so when you will take a temperature from the rectal route, you have to monitor while documenting the value. You have to deduct 1 degree Fahrenheit. Okay, because the rectal temperature 1 degree Fahrenheit more than the oral temperature. Oral will give the as it is. Okay, if your body temperature is 97, it will show exactly 97. Okay, but rectal, if your body temperature is 97, it will show the 98, because where we are assessing the core body temperature, right? So while documenting the rectal temperature, we have to deduct 1 degree Fahrenheit. Okay, so same from the auxiliary. Okay, you are taking the auxiliary temperature, means how much you need to add into the auxiliary temperature. Yes, you are getting the 96 degree Fahrenheit, means please add 1 degree Fahrenheit to that one and document. Okay, so 96 you are getting, means 97 you have to document, because auxiliary temperature is 1 degree Fahrenheit less than the oral temperature, and a rectal temperature is 1 degree Fahrenheit more than the oral temperature. And oral temperature is the as it is temperature, we will get that one. Okay, sometimes the examiner will ask the difference between the rectal temperature and auxiliary temperature. Okay, so that is the 2 degree Fahrenheit difference will comes. Okay, so this is the golden points I have chanted in front of you people. Okay, so the comes to your core concept here. So now the nurse inserted the thermometer, okay, to obtain the core body temperature during the procedure. The child suddenly becomes pale. Okay, what happened? The child is suddenly become pale in color, then limbs, and he monitors the heart rate of the child. So the child heart rate is coming only 45 beats per minute. Okay, so that is very low heart rate. So the question is why? So what is the most likely cause of the this sudden bradycardia here? Okay, so there is one very important concept. All you have to know that one. So that is the activation of the our vagus nerve. Okay, so vagus nerve is the 10th cranial nerve. Note down the very important point. The vagus nerve is the which cranial nerve? Vagus nerve. Vagus nerve is the 10th cranial nerve. Vagus is the our 10th cranial nerve. So this is and the a parasympathetic nerve. Very importantly, whenever we will stimulate the vagus nerve, it will increases the parasympathetic activity. So parasympathetic activity, yes, whatever it causes the heart rate to decreases. Okay, so then it increases the salivation increases, and it increases the GI motility. GI motility, it increases, and it increases the urine output. Okay, urine output also it increases. So here, very importantly, whenever there is a stimulation of the vagus nerve, so parasympathetic nerve system activates, then the heart rate becomes decreases. So this is the reason where we are inserting the thermometer in the anal sphincter, means there is highest chance of the stimulation of the this particular vagus nerve. If the vagus nerve is get stimulated, means the parasympathetic nerve system will activate and the heart rate will come decreases. So if heart rate is decreasing, means we call this one as in the bradycardia. Okay, so most important and very important. So what is the most likely cause of the sudden bradycardia here? So our answer goes to the option C, that is the vagal stimulation from the rectal thermometer insertion. So this is the correct answer. And this question what I have explained in front of you all, and this concept of the vagus nerve induced bradycardia, it's a very important concept. So this is one style of the asking question from the vagus induced bradycardia. The another style of the question of the asking the vagus induced bradycardia is like this. So as a nursing officer of the AIMS, you are working in the ICU. Now you got a patient that which is there in the tracheal section. Okay, and you inserted the suction catheter inside the patient. Okay, so now you have inserted the catheter till the resistance comes. Without pulling back the catheter 2 centimeter above the carina, you have applied the suction catheter. Now you have stimulated the trachea and carina. So what is the expected outcome you will experience here? Yes, the when you will do the tracheal suction without pulling back 2 centimeter above the carina, so if you are directly stimulating the Trachea means carina means where there is again the vagus nerve will activate. So we will expect the bradycardia. Okay. So this is the very important point. So two style of the asking question, that is the rectal thermometer means you are inserting the vagus nerve induced bradycardia. Suction pressure you are applying directly over the carina. So again, a vagus nerve induced bradycardia. Very important question, and almost all people have chosen the correct answer. So this is from one question we have solved the many questions. Okay. So what are those questions? A pediatric or rectal temperature. It's a core body temperature, and all golden point I have chanted in front of you people, and length of insertion I have told, and sudden bradycardia due to the rectal thermometer insertion which induces the vagus nerve, and vagus nerve is the 10th cranial nerve. Okay. And which is the parasympathetic nervous system activating nerve. Okay. And all the very important points related to the parasympathetic nervous system activation I have told to you people here. Okay. So when the parasympathetic nervous system activates, what happens to the pupils? What happens to the pupils? Yes, the pupils will get constrict. Okay. So pupils becomes constrict here. In the sympathetic nervous system, pupils become dilates here. Okay. So this is the a very important concept. So what you have to know here. Then so know the very important point. There is the contraindications of measuring the rectal thermometer. Okay. So rectal temperature measuring contraindications are there. So that one you have to know most importantly. Okay. Whenever the neonate is there, so there is specially a preterm neonates. So you are trying to insert the rectal thermometer means it damages the rectal mucosa and it damages the rectal anal sphincter. So never ever insert the rectal thermometer in the preterm infants. Okay, and neonates. Very important. Preterm neonates and preterm infants. So never ever insert the rectal thermometer. When the patient is having the neutropenia, what is neutropenia? Yes, the deficiency of the neutrophils means neutrophils is the type of the WBC. Okay, so here the WBC or the neutrophils, WBC or the neutrophils are decreasing, and you are inserting some external material inside the body means which may carry the some minor infection also, it becomes major. Okay, why? Because the patient immunity is low because of the decreased WBC. WBC is the thing which is responsible to fight, okay, against the all the infections. Okay, so if there is neutropenia or we can say the leukocytopenia, the decreased WBC, there is highest risk of the infection is there. So always don't insert the rectal thermometer inside the body in case of the neutropenia, and most importantly don't insert the rectal thermometer in case of the any bleeding disorders and where there is in the thrombocytopenia. Okay, thrombocytopenia. Okay, so what is thrombocytopenia? Thrombocytopenia is the decreased platelets. Okay, so decreased platelets means increased risk of the bleeding. Okay, increased risk of the bleeding. So at this point of the time also don't insert the rectal thermometer. It is very important point you have to know. And if the child is having the recent surgery and trauma to the anal area, so don't do a rectal thermometer. And hemorrhoids are there, anal fissures are there. So very painful. Anal fissures are the very dangerous painful, and hemorrhoids also very dangerous painful. So in these both, in the hemorrhoids and in the anal fissures, so priority interventions goes to the pain control. Okay, pain control is the priority intervention in the both hemorrhoids and the anal fissure. Especially at the anal fissure, priority goes to the pain control, and in the hemorrhoids also the priority go to the pain control. In the external hemorrhoids, pain control is the priority. In the internal hemorrhoids is completely painless hemorrhoids. Okay, so a hemorrhoids which is happening above the anal sphincter, that's the internal hemorrhoids. Internal hemorrhoids are the painless hemorrhoids. Okay, the hemorrhoid which is happening after the or below the anal sphincter, so that is called as the external hemorrhoids, and external hemorrhoids are the extremely painful hemorrhoids. Okay, so in the external hemorrhoids, pain control is the priority. In the anal fissure also the pain control is the priority. Okay, here already patient having the excessive pain and some abnormal disease conditions in the anal sphincter and in the anal cavity, and you are externally inserting the rectal thermometer means it definitely like causes the extreme pain to the patient. So don't insert in the hemorrhoids and anal fissure, don't insert the rectal thermometer. Then comes to the child is having the diarrhea and rectal infections means don't use the thermometer because a thermometer will come with the infection out. Okay, so that is the reason. And some bleeding disorders, anticoagulant therapy, patient is on heparin warfarin, so don't use the what we can say this one rectal thermometer. Okay, then increased risk of the rectal bleeding, don't use the rectal thermometer. Then the spinal cord injury is there. Okay, so if you are stimulating the rectum with this particular what we can say thermometer means it try to send the signals to the brain, but at the level of the T6, if there is a level of the T6 and above, if injury is there, so the signals will go. Okay, but it will not returns back, so that may leads to the upper extremities a completely hyper dangerous hypertension happens, and completely upper extremities become pink, and a extreme hypertension, thrombing headache, and a piloerection, entire hair will get erect. Okay, so this happens because of the our autonomic dysreflexia. Okay, if having anyone is having the doubt related to the autonomic dysreflexia means in the OBG, sorry, in the RRB and Norcet 8 important sessions, I have discussed in one video completely related to the autonomic dysreflexia. If any one of you having any doubts related to autonomic dysreflexia, like why hypertension and bradycardia happens in the autonomic dysreflexia, so if you having any doubts, you can watch that video. Okay, so remember in the autonomic dysreflexia, a classical picture is the hypertension, that is the dangerous hypertension, and bradycardia, that is the heart rate becomes decreases, very very important. Okay, so in the this is the classical picture. Okay, so high heart rate decreases means due to the excessive hypertension, it sends the signals through the baroreceptors to the brain, and brain sends the signals back to the heart, so that it's already excessive blood pressure is there, so please control the rate of the heart. Okay, because of the signal of the brain, the heart rate decreases, but the patient is manifest with the hypertension. So hypertension with bradycardia is the classical picture of the autonomic dysreflexia, and this autonomic dysreflexia is stimulated by the impacted bowel. Okay, where there is in the priority interventions of the nursing officers to don't make the impaction of the bowel. Okay, so keep on emptying the bowel, keep on emptying the bladder. Okay, so don't keep the bladder to get distant. Okay, and don't insert the any rectal thermometer, and don't allow the patient, don't make the patient to get pressure ulcers. So these are the triggering factors: a full bowel, full bladder, and rectal thermometer, and a pressure over the back. Okay, especially at the sacral region, the pressure ulcers. So these increases the like chances of the autonomic dysreflexia in spinal cord injury patient if the damage is above T6 and above. Okay, so this is the very very dangerous, and in case of the spinal cord injury, taking a rectal thermometer is contraindication. Okay, so all possible things with a golden point chanting we have covered. Okay, not only contraindication, another points related to that one we have covered in this particular explanation. So hope it is very well understood to you people. Okay, so here the yes. Next question. Do read the question completely till the end and try to give the best answer. I'm waiting for your answer in the comment box. So fatafat. Right. The question is very simple. What is the correct method of cleaning the clinical thermometer after the use? After the use. Okay. So option A is rinse under the hot water. So in the clinical thermometer, there is mercury is there, the glass clinical thermometer. If you are using the hot water means a suddenly rise in the mercury happens and the thermometer will get blasted. Never ever use a hot water. Okay, so then comes to the option D, soak in the boiling water for 10 minutes. No, so we have to soak it in the water and soap. Okay, not in the boiling water. Okay, so wipe with a dry cloth and store immediately. No, it's not in correct method. So only best method is the wash with soap and cold water. Okay, not extremely cold, just lukewarm is the okay. Okay, lukewater is the okay. Then disinfect with the alcohol. The question will come. So what is we will use to disinfect the alcohol? Sorry, used thermometer. So to disinfect the used thermometer, that is the 70 percentage isopropyl alcohol. That is what we will use for the hand washing also. The range is from the 65 to 75. Okay, the best one is the 70% isopropyl alcohol. So we are using for the hand rubbing. Okay, that is the alcohol based hand rubbing, and same solution we will use for the disinfectant, the thermometer. Okay, so before disinfecting the thermometer, we have to keep the glass clinical thermometer in the soap and water. Then we have to disinfect with the alcohol. This is the correct method. Okay, so the another important questions comes as the image based questions. So quickly let us revise the important image based questions. So this one, image number A, what is this, what is this? And in this one we are having the two types, that is the first one, second one, this one, this one, this one. Okay, so let me fadafat explain the thing to you people. So this is the chemical dot thermometer, and this one is the disposable thermometer. Okay, so here the reading will be there here. Okay, so it will comes in the two form. One is the Celsius form, and one more is the Fahrenheit form. Okay, so this is the, just you have to remember it is in the chemical dot thermometer, and so we will use this type of the disposable thermometer to check the temperature in the patient who is isolated and patient who is having the contagious diseases, like where we can use the thermometer one patient and we can't use that same thermometer to another patient. So that time, every time while checking the temperature, we can't use the our regular hospital thermometer, right? So because it is spreads infection to the others. So in the case of the isolated patient, the best mode of the assessing the thermometer with which device, that is with the chemical device, chemical dot thermometer is the best in the isolated patient. So this case of this kind of the clinical based questions we people may face in your exams. Okay, so this is the glass thermometer. Okay, so in this glass thermometer, two type of the thermometers are there. One is this one, cylindrical edge one, and another one is the bulb is a spherical shape, or we can say the round shape bulb. Okay, one is the cylindrical shape bulb. Okay, so why this is different? Yes, this is the glass thermometer, very important, glass clinical thermometer, we can say glass clinical thermometer. Okay, so it's very important. Why this is two difference? Yes, the first one is for the oral temperature management, oral temperature measurement, and second one is for the rectal temperature measurement. Okay, second one is for the rectal temperature measurement. Very important, bacho. So here focus over the this particular bulb of the our thermometer. Okay, so this is what we call as the stem of the thermometer. Okay, and this end what we call as the bulb of the thermometer. Very importantly, and if the bulb is cylindrical shape, that is the oral thermometer. If the bulb is spherical or round shape, that is the rectal thermometer. The image based questions will come and you people will confuse, and so to prevent the confusion, where you have to focus, we have to focus on the bulb. Okay, so because the stem is same to everyone. Okay, so then one more clinical important question will come. So after the use of the thermometer and before the use of the thermometer, so how to clean the thermometer? Okay, so the cleaning of the thermometer before the use is the, yes, so this particular portion will be in the our what we can say soap and water, and we have cleaned perfectly with the this one what we can say isopropyl alcohol. Now this one is the less contaminated, and this portion where we are holding our hand, and this is the more contaminated. Okay, so before the use I am telling. Okay, so now I am telling before use. Okay, so first before the use we have to start with the less contaminated to the more contaminated. Means how we have to clean? We have to clean from the bulb to stem. Okay, before the use we have to clean from the bulb to stem. Then after the use, this particular portion we have kept in the patient. Okay, so now this is more contaminated and this is the less contamination. So now after the use, this portion is the less contaminated and this portion is the more contaminated. Start from the less contaminated, go towards the more contaminated. Okay, so after the use we have to start with the stem and go towards the bulb. Okay, so this question also it will comes in our exams. Very important, bacho. So focus on this one. mention the correct answer. Don't do the silly mistake. Okay, these are not silly mistake. These are your negligences. Okay, so control the negligences in the exam to get the better rank. Okay, so here is the next very important thermometer. This is a digital thermometer. We can say digital clinical thermometer. Okay, so very importantly, and here is the confusion arises between these two things. Among these two things, this is the D and this is the E. Which one is the tympanic thermometer? Fatafat do comment in the comment box. Among these two images, which one is the tympanic thermometer? Yes, Fatafat, please do response. Well done, beta. Well done. So this E is the our tympanic thermometer. This is the tympanic thermometer, and sorry, E is the tympanic thermometer, and this D is the our infrared thermometer. What is the name of this one? This is the infrared thermometer. Very importantly, sir, how to differentiate? Look at this particular ads. So it is like a device which we can insert inside the ear and we can take directly a temperature from the or tympanic membrane. Okay, so the tympanic membrane also a core body temperature, remember. Okay, so then this one as an infrared thermometer we can hold in front of our forehead and we can need to press this button. Okay, so then it will show the temperature directly here. Okay, so this is the infrared forehead thermometer and this is the tympanic thermometer. The image based questions may strikes in your exam. Okay, don't confuse because it's in similar questions. Okay, so that is what I am telling to you people. And before going to the main question, next question, here is the beautiful advertisements to you people, that is who all are preparing for the Norcet mains exams. Okay, so here's the fully planned Norcet mains mission test series is already launched in the Master Nursing Classes app. So all people have to do is to download the Master Nursing Classes app from the Google Play Store. The link is given in the description box and comment box. And who all are preparing for the RRB Nursing Superintendent exam, okay, for you people, a fully planned a 30 super model test papers where the all important questions, a clinical based questions, one liner questions, scenario based questions, priority based questions will be added. Okay, completely fully fledged package to you people. Okay, if anyone is preferring for the RRB nursing superintendent exam, take utilize of this one where it is as the same exam pattern. Okay, the 30 nursing questions, 70 nursing questions, 30 non-nursing questions. Okay, so according to the RRB syllabus completely covered. Okay, if you are interested, so the link is there in the description box and in the comment box, you can take from there. Okay, so here is the next question. Yes, so yes, here is the next question. So do read the question fatafat and try to give your best response to this particular very important question. Okay, so which of the following is the most important consideration when using the or when measuring the oral temperature in a patient? Okay, so you are measuring the oral temperature in a patient, so what is the most important consideration you have to do here? Let me quickly read the options and I will differentiate the correct answer to you people. Okay, option A is telling that the yes, till that all you people once try and give the best shot in the comment box. So option A is telling ensure the patient has eaten or drinken sometime something cold or hot before taking the temperature. Bacho, it's not to ensure that the patient has taken. No. So patient should not be taken any hot or cold things before taking the temperature. Okay. So this is not our correct answer. Then comes to the option B. A patient must close their mouth around the temperature thermometer to accurate reading. Yes. So where we have to keep the thermometer, we have to keep the thermometer in the sublingual pocket. Sublingual pocket means below the tongue we have to keep the thermometer and we will ask the patient to close the mouth. Okay, because the external temperature will not vary the accurate reading. And so most importantly, so we have to hold the thermometer below the tongue. Okay, I am mentioning again the word, that is the below the tongue in the sublingual pocket we have to keep. Okay, to maintain to keep it in the place for at least 3 to 5 minutes. We have to ask the patient to completely close the mouth and hold the thermometer between the lips. not between the teeth. बच्चों advised, okay, advised to the patient not to hold the glass mercury thermometer between the teeth. If the child is holding, or the sorry, if the person is holding between the teeth, means if someone given dhakka to patient, you consider his teeth will crush the thermometer and his entire mercury will leak in the mouth. It's very dangerous. Okay, so that is the reason ask the patient to hold the mercury thermometer between the lips, and we have to seal the thermometer with the lips. Very very important. So that is the patient must close their mouth around the thermometer to for the accurate reading. Okay, so this goes to the correct option here. Then option C, the thermometer should be placed in the outside of the mouth. No, as I told, we should keep this one in the sublingual pocket inside the mouth. Okay, the option D, the thermometer should be placed only on the tongue. Okay, it's not on the tongue, it's in below the tongue. Okay, it's in below the tongue. Okay, so it's a very very important thing. And here are the some very very important golden point chanting for you people. Okay, that is the contraindications of for measuring the oral temperature. Okay, so the measuring the oral temperature in the semi-conscious and unconscious patient through the thermometer is completely contraindicated. Why? Because a semi-conscious unconscious patient, first of all, they are unable to seal the thermometer with the mouth, and there is highest risk of the swallowing of the thermometer is there in some cases. And so if the patient is semi-conscious and you are keeping the thermometer in the mouth of the patient, means the patient may crush the thermometer between the teeth. Okay, so that is the reason don't use the oral temperature methods in the unconscious and semi-conscious patient. Okay, the next one is the infant and young children's. Okay, who all are less than 5 years of the age. So the measuring the oral temperature is the contraindication. Okay, the child is less than 5 years of the old, like especially infants and young children. So they will not cooperate. First of all, they will not hold the thermometer in the mouth, and so there is again chance of the crushing of the thermometer is there. So the reason is this one. So don't use the oral temperature methods of measuring the temperature in the infants, children, and the less than 5 years. Okay, so this is most important. Okay, then comes to the already if the child is having or the person is having the oral lesions or sores like mouth ulcers post surgery, so don't use the thermometer, oral thermometer. Then severe nasal congestion. Okay, in the severe nasal congestion, the nose is completely congested and the person unable to take the breath from the nose and now is taking the respiration through the mouth, right? So here we have to keep the thermometer in the mouth for 3 to 5 minutes, right? The nose is also congested and it is blocked, and we are asking the patient to uh, hold the thermometer under the tongue and close the mouth completely like this, means he is unable to breathe, means a complete breathing is blockage here. So in the patient with the nasal congestion, so there is contraindication for the measuring the our oral temperature because it completely block or seals the airway. Okay, then next one is the recent eating and drinking or the smoking. So we have to make sure that the patient should not eat on anything, should not drink on anything, and should not be smoked. Okay, if the patient is drunk some cold or hot food, or recently if the patient had the food, or the patient recently smoked, means we have to wait for the 20 minutes. Okay, the single best answer is the 20 minutes. And in range the option is coming, means we have to wait for the 15 to 30 minutes at least, and the single best answers we have to wait for the 20 minutes. So this question repeatedly striked in your exams, and this infants and children less than 5 years repeatedly striked in your exams, and semi-conscious unconscious patients repeatedly striked in your exams. Very very important. Okay, so patient is had recently had the food drunk or the some smoking is done by patient, means how much duration we have to wait? We have to wait for the 20 minutes is the single best answer, and in range we have to wait for the 15 to 30 minutes. Again I have repeated this point, means consider it as a very very important point. Okay, and children with the history of the seizure, very very important. The child is having the history of the seizure. Okay, monitoring the oral temperature is contraindicated because we have kept the thermometer you consider, and at the same time the patient got the seizure, means a thermometer in the mouth may damage the oral cavity, buccal mucosa, and if the child is got the seizures, means a glass thermometer if we have kept, means it may crush under the teeth. Okay, so that is the very very important in the child with the seizures. Okay, so we won't use the our oral temperature measurement. Okay, then comes to the patient recently had tracheostomy, means he unable to breathe from the mouth. Okay, there is no air enter from the mouth and it may gives the false result. Okay, so that time don't use the thermometer if the patient is having the recent tracheostomy. So these are the very important golden point chanting I have done in front of you people. So it is very much helpful to you people in the mains exam. Okay, so whatever the questions I am bringing in front of you people, that is the most important, and along with that I am dealing the concept. So these concepts help you to people to eliminate the options in the mains exam. If the direct same questions are not coming, you can utilize this core concept what I am teaching here. Okay, and you can eliminate the options to get the correct answers. Okay, so that is the most important thing all you people have to do in the your mains exam and RRB nursing superintendent exam, right? So here is the next question. Yes, the question is very simple. In which type of the fever does the temperature fluctuates daily but never returns to the normal? Okay, the temperature is fluctuating. Consider this is our graph. Okay, so here you consider 96, 97, 98, 99, okay, 100, 101, 102. Now the temperature is there. The patient is the 99 you consider, and it's fluctuating. It is going to the 102 and coming to the 100, then coming to the 102, 100, 101. Okay, the temperature is fluctuating, but it is not coming to the normal. Okay, it is not coming to the normal. So what we call this kind of the temperature is the fluctuation is there, but never returns to the normal. So what we call this one? Yes, the fluctuation is more than 2 degrees Celsius also. You can take one more clue. Okay, the fluctuation is more than 2 degree Fahrenheit, not Celsius. The fluctuation happening more than 2 degree Fahrenheit, but it will not coming to the normal. So this type of the fever we call as in the remittent fever. Okay, so remittent fever. So let me quickly discuss all kind of the fever that is most important for your upcoming Norcet mains exam. Fix. I am writing a very important one type of the fever, phases of the fever. Definitely one questions will strike in your exam. Okay, so the very important explanation is the very simple explanation I will give. So take a point, take a notes or take a screenshot and revise immediately after your exam. Okay, sorry, after your this particular important class. The first very important one is the intermittent fever. Okay, intermittent. What is the intermittent? Intermittent means yes, not continuously. There is thing is there and it will get comes to the normal, then it will again arises. Okay, so it is not continuously present. It will present for a short duration, then comes to the normal, and it will again present for a short duration. Okay, so here in the intermittent fever is the same thing. Fever spikes are there but returns to the normal. Okay, so it comes to the normal. Okay, between the episode within the 24 hours. Okay, consider the same fever spike are there here. Okay, fever spike is there, then it is coming to the normal. Okay, then again the fever spike is coming. So this is what we call as in the intermittent fever. Okay, intermittent fever in a 24 hours a fever spike, it will comes to the normal. Okay, so that is the intermittent fever. So I hope it's clear to you people, and this is the graphical representation of the intermittent fever. The image based questions also the examiner can throw in front of you people. Okay, so here look up, the fever is there, it reached here till 40 degrees Celsius, then comes to the normal, then it reached here 40 degrees Celsius, then comes to the normal. Means here the temperature is varying and it is coming to the normal. Okay, so that is the intermittent fever. But considering the remittent fever, yes, the temperature is raised here and which is fluctuating, where there is increase decrease is there, but never it comes to the normal. Okay, so here it is fluctuating between the 39 degrees Celsius, 40, 39, 40, 39, 40. Okay, in the 24 hours a more than 2 degree Fahrenheit fluctuation is there, but it is never coming to the normal. So this is the remittent fever. This is what we have asked in the question, and this was your answer in the this particular question. Okay, so that is the remittent fever. Then comes to the next type of the fever, that is most important. Okay, I already explained this one, remittent. Then the continuous fever or the sustained fever we can say. Okay, where the temperature remains elevated within a minimal variation of the less than 2 degree Fahrenheit. Okay, less than 2 degree Fahrenheit. So what is continuous fever? Means the fever is continuously high only, and which is varying less than 2 degree Fahrenheit only. Okay, so this is what you call as the continuous fever. Okay, look at this one. Okay, so don't consider this as the Celsius, consider this one as the Fahrenheit. Okay, so this one is the consider the 99, and this one is the 101. Okay, the fluctuation is there, the fever fluctuation is there, but less than 2 degree Fahrenheit. Okay, less than 2 degree Fahrenheit fluctuation is there, and it remains continuously high. So that is the continuous fever. Okay, in the remittent, what happening, the fluctuation is more than 2 degree Fahrenheit. Okay, the fluctuation is more than 2 degree Fahrenheit in the remittent fever. Okay, and in the continuous fever the fluctuation is less than 2 degree Fahrenheit. Okay, here also consistently high temperature is there without coming to the normal, and here also in the intermittent also, sorry, in the remittent also continuously high temperature is there. So you can focus over the graph, you will understand. Okay, here is the more fluctuation, means the fluctuation is varying more than 2 degree Fahrenheit but not coming to the normal. Here is the less fluctuation, means the temperature is rising, okay, continuously high only, but fluctuation is less than 2 degree Fahrenheit. Okay, so that is what you call as the continuous fever. So then comes the intermittent fever, we have already discussed. Okay, the next fever type is the relapsing fever. Okay, so next fever type is the relapsing fever. Here the episode of the fever which is separated by the days or the days of the normal temperature. Okay, so what happens in the relapse fever, the fever spike will come. Okay, so the fever spike will come, and for the several days or for the several hours, so not hours, we can say the days only. Okay, not in hours. So for the several days it will comes to the normal, again one episode of the fever, and for the several days it will come for the normal. Okay, so that is what we call as the relapsing fever. Okay, so this is what we call as the relapsing fever. For the several days it will be normal, then again a fever spike will here. Okay, so this is what we call as the relapsing fever, very very important. Then comes to the Pell-Ebstein's fever. So Pell-Ebstein's fever is a classical fever seen in the Hodgkin's lymphoma. Okay, so in the Hodgkin's lymphoma, which fever will be seen? So that is the Pell-Ebstein's fever. So very very importantly, the cyclical fever is there, where the several days high temperature will be there, followed by the febrile. Okay, so continuous 4 days high temperature is there, then followed by the febrile, means no fever. Then comes to the 4 days of the high temperature, then a period of the again febrile, means no fever. So this is what you call as the Pell-Ebstein's fever, which will be classically seen in the Hodgkin's lymphoma. Then comes to the inverse fever. Inverse fever. Inverse means ulta. Okay, what is the inverse? Inverse means ulta here. So what happens? So for me, in the early morning, 4 o'clock, 6 o'clock, my body temperature is very cool, calm. Okay, and entire day I will work. Entire day I will work. Okay, so my metabolism is increased now, and at the evening my temperature is high. So this is the normal process. Our body temperature early in the morning is the low, and our body temperature at the evening is the high. Okay, this is the normal process. Here it happens ulta. So early in the morning, increased body temperature is there. So early in the morning, not in the evening. So early in the morning, increased body temperature is there, and in the evening there is normal body temperature, or we can say the decreased body temperature, means this is what we call as the ulta. Okay, so refers to the fever that is higher in the morning and lower at the night. Okay, that is the inverse fever. So this is the opposite of the usual normal pattern. Okay, so that is the very very important thing. And this inverse fever is the classically seen in the typhoid fever. Okay, so typhoid fever we can say also the enteric fever. Okay, so which is caused by the Salmonella typhi. So this is your golden point, very very important point. Okay, so let me quickly revise this one. And this undulant fever is a waveform fever, okay, which is the wave like. How the waves will come in the sea, like that. This is the waveform fever. This is called as the undulant fever. The undulant fever is classically seen in the brucellosis. Okay, brucellosis. Very very important, bacho. Okay, the brucellosis fever is the undulant fever. That is the waveform fever. And most importantly, in the clinical history of the brucellosis, the patient will say, yes, the patient had the unpasteurized milk. Okay, so having the unpasteurized milk increases the highest risk of the brucellosis, and it is classically seen with the undolent fever. Okay, this is the biphasic fever where it will become in the two phase. Okay, one high phase, then the one, another same phase. Okay, this is the biphasic fever. It's not that much important. The recurrent fever means the fever is coming repeatedly. Okay, so that is the recurrent fever. Okay, so all thing is clear to you people, I think so. And explanation to this kind of the fever is, I hope it's completely clear to this fever. Okay, so here is the step ladder fever, means the fever is coming like this step. Okay, step by step. So this is what we call as the step ladder fever. It is a classical seen in the typhoid. Okay, the quotidian fever, one fever spike is there in the 24 hours. Okay, so that is the seen in the classically malaria. Okay, so then comes to the low grade fever, the classically seen in the tuberculosis. Okay, in the TB patient, the night sweat, weight loss, and a low grade fever is a classically seen in the our tuberculosis patient. Okay, what are the things? That is the night sweat, weight loss, and low grade fever is the classical picture of the TB patient. And along with that, more than 2 weeks of the cough. Okay, so more than 2 weeks of the fever, that is a low grade fever. Okay, this is the more than 2 weeks is the most important criteria here. For to say this one is in the TB. Okay, so hope this all classical thing is clear to you people, right? So our answer for the question is also clear here. Okay, so the pale abstinent fever is seen in the Hodgkin's lymphoma. Okay, and the septic fever is the fever which will be seen in the sepsis, or we can say the bacterial toxins in the blood. Okay, then intermittent fever, we have explained everything very clearly. Hope it is completely clear to you people. And here is the a golden question, the golden question. Okay, so directly it will comes in your exam. It's a very important. It's a very important. There is highest chance of the copying this question from here master nursing classes to your mains exams, or in your ASSC exam, sorry, in your RV nursing superintendent exam. Okay, so yes, the question is very simple, and which is giving the 6 to 8 clues to choose one answer. Means a long stem questions are the very easy questions, because to choose one particular answer it will give us a 5 to 6 clues. Okay, but in one liner question it will give only one clue. We have to choose based on that one. But in the long stem question it will give 5 to 6 clues to choose one answer. So which one is easy? Yes, a long stem is the easy question. Okay, and here the one thing which matters is the time management. So that is the reason in the first 6 papers of the our Norcet means, which is completely built on the time management, where the entire thing will be faced by the our aspirants will be reducing the anxiety, managing the time. Okay, and covering the high yield and quality content that is much necessary for the exams. Okay, so that is what everything is, I repeatedly tell, fully planned. Your time management is planned, your syllabus is planned, your high yield points are planned, your important questions are planned, everything is planned. Okay, so the planned thing is, if we execute it perfectly means it will give the perfect result. Okay, so if you are still not part of the mains mission test series, and if you are not a part of the RRB Vande Bharat test series, the link is given in the description box. You can download and enroll that one. Okay, that's the most important, right? So the next question here is the very important question. So I want to answer from you all. Fataфат do comment. Yes, the question is very simple. A 17-year-old male patient with 6 days of the gradually increasing fever is there. Okay, so gradually means slowly the fever is increasing. Okay, then the abdominal discomfort is there. The patient is saying the abdominal pain or the abdominal discomfort, and patient is feeling the fatigue. Okay, yes, that's okay. Then the next is the, he mentioned that fever tends to be higher in the morning than the lower in the evening. Okay, yes, this one classically we have just seen the clue. The fever tends to be high in the morning and low in the evening. Okay, and he has not had any recent travels. Okay, he have never gone to the like a area of the high incidence. Okay, he have not any having the no any recent travel history, but he tells, but he tells he have eaten some street foods. Okay, so on the exam the coated tongue is there, tongue is completely coated, then the mild splenomegaly is there, and relative bradycardia, the one single best word, the relative bradycardia. And the most important word, the fever high in the morning and low in the evening. These two words are enough to choose the correct answer. Yes, where we have to choose this one. A correct answer is our, yes, that is our which answer? Very nice of you all. That is the typhoid fever. Okay. So just only we have discussed the thing. Okay. So that is the typhoid fever, which will be seen classically in the inverse fever. Okay. So we can say typhoid fever as in the enteric fever, where the fever is higher in the morning and lower at the night. Okay. Another one more very important classical features they have given, the relative bradycardia. So what is the meaning of the relative bradycardia, sir? Why we have to choose this one as a classical and important word here? Bacho, if fever comes to you, fever comes to me, consider my body temperature will increases, means my body metabolism will increases. When my body metabolism increasing, that time my heart should compensate to meet the need of the metabolism by increasing its rate. Okay, so every time, every condition, the body temperature is increasing, means the heart rate should increase. But the only one condition where the body temperature increasing, the heart rate is decreasing. That is what we call as the relative bradycardia. Is a classical thing which we will see in the typhoid fever. So it's somewhat changed from the others. So it's a favorite of the examiner. So consider this one as the classical point, very important point. Answer choosing point. It will help to you people. So our answer here is the typhoid fever. Hope it's completely clear to you people. And typhoid is caused by the Salmonella typhi, Salmonella paratyphi, and it's in the fecal-oral route disease, where there is a chance of the some abdominal pain is also there. Yes, it's given a fecal-oral route. The continuously abdominal pain is there, fatigue is there, and the patient is also having the fecal-oral route evidence here. There is he had the food from the street. Okay, then the splenomegaly is there, coated tongue is there, means the fecal-oral, all the symptoms they have given, plus relative bradycardia, the classical picture, and the very important type of the fever, that is the inverse fever they have given. So that is what we call as the typhoid fever. The another name of the typhoid fever is the enteric fever. Enteric fever. So it's a very important. I told. Okay, so I think it's clear to you people. Then the next question is very important question. The long stem questions always gives you a more clue to choose the answer, but you have to learn the time management. So we have planned that one to you people. Don't have to worry about that one. Okay, so just give a test series and see how your score will improve in the final exam. Okay, so the next question is the a 22-year-old college student presents with a high grade fever here. Okay, so the high grade fever is there for the past 3 days associated with a severe headache. Okay, then the severe headache is there, along with that severe joint pain and muscle pain. Okay, so very importantly, high grade fever, that is in a college student, high grade fever is there, and which is associated with severe headache, severe joint pain, and the severe muscle pain. Okay, and the pain behind the eyes, very important. A pain behind the eyes is also called as in the retroorbital pain. What we can say, this one is in the retroorbital pain. Means retro means behind, orbital means our eye orbital. So the pain behind the eyes, that is the retroorbital pain, and this pain is increasing when we move the eyes like this. Focus on my eyes. When I move the eyes like this, the pain will increases. Okay, so when the pain is there behind the eyes and which worsens with the eye movement. Okay, so then he recently returned from the trip. Okay, the patient is having the history of the, he went to the somewhere out of country and he returned from the trip, and that is the tropical area. Okay, that is the tropical area where there is a highest chance of this particular disease is there. Okay, so then on examination temperature is 39.5 degrees Celsius and faint maculopapular rash, the maculopapular rash, okay, seen on the trunk. Okay, what is the correct answer? You have to choose here. Okay, the retroorbital pain sudden high grade fever with joint pain, muscle pain. So we can say the joint pain, muscle pain is a bone breaking fever. Okay, so the bone breaking fever is the our dengue fever is the bone breaking fever where there is a classical picture of the retroorbital pain with the fever. Okay, so this is what we call as the dengue fever, most important, and a maculopapular rash will be seen in the dengue fever. Most importantly, sets the criteria of the dengue fever here. So that is the most importantly, a sudden high grade fever is there. Yes, in the question, the sudden high grade fever is there. Yes, sir. Then comes to the retroorbital pain is the classical picture. There is the pain behind the ear. Yes, sir. In the question, the retroorbital pain, the pain behind the ear is also given, sir. Then the severe myalgia, that is the severe muscle pain and the severe joint pain, severe arthralgia. Yes, sir. In the question, severe muscle pain is also there, sir, and severe joint pain, that is the severe arthralgia is also there, sir. Then comes to the rash, that is the maculopapular rash. So yes, this one is also there, sir. So this classically indicating, sir, the patient is experiencing the dengue, sir. Okay. Yes, dengue is caused by the dengue virus, that is the den1, den2, den3, den4 viruses. Okay, so it is transmitted by a vector that is called as in the Aedes aegypti. Okay, so yes, the dengue is transmitted by the vector called as a mosquito. Okay, in which mosquito? So there are lots of the type of the mosquito is there. There is the Mansonia, okay, and female Anopheles mosquito and Aedes aegypti mosquito. Among all, which mosquito causes the dengue fever? There is the Aedes aegypti mosquito causes the dengue fever. Okay, that is the vector to transmit the dengue. Okay, so in the dengue, which blood cell will decreases? Yes, one is the Aedes aegypti mosquito. Very important. All the people have to know this one. Then comes to the very important point, which blood cell will decreases in the dengue fever? The platelet will decreases in the dengue fever. So that is very dangerous. Okay, where in the severe dengue fever, so we are not taking care of the patient properly, means it will go into the severe dengue fever. So that is the dengue hemorrhagic fever because of the low platelet, which is very dangerous, and because of the disseminated intravascular coagulopathy in the dengue. So the patient may go into the dengue hemorrhagic fever where the patient is complaining of the urine, blood is coming in the urine, blood is coming in the stool, blood is coming in the sputum. Okay, so blood is coming in the sputum means what we call that one as the, yes, blood is coming with the sputum, that is the hemoptosis. Okay, what is that one? Hemoptosis. Blood is coming in the vomit, what we call that one? The blood is coming in the vomit, that is the hematemesis. Okay, hematemesis is the blood is coming in the vomit. Okay, hemoptosis is the blood is coming in the sputum. Okay, then blood is coming in the urine, that is called hematuria. The blood is coming in the urine, that is called as hematuria. The blood is coming in the stool, that is called as the, if the occult means the old blood is coming in the stool, means we call that as the occult stool. Okay, if fresh blood is coming in the stool, means we call as in the hematochezia. Okay, so that is the very important thing you have to note down. Okay, which will be seen in the patient with a dengue fever. Okay, that is what, whenever a patient with dengue fever comes to your hospital, the IV fluid replacement is the priority. We don't have the specific treatment for the dengue fever. There is no antibiotic because a dengue fever is the viral fever. So why? What is the use of the antibiotic here? There is no use of the antibiotic in the dengue fever because antibiotics are used to kill the bacteria, not to kill the viruses. Okay, so the dengue fever is the viral fever, no use of the antibiotics, and the priority is to replace the fluid to the patient, continuously keeps on giving the fluid. Why? Because if the patient is going into the dengue hemorrhagic fever, we have to control that one. The fluid priority, fluid management is the very important, and keeps on monitoring the platelet count. If the platelet is going very low, okay, so then there is requirement of the platelet transfusion will be there. So that is the reason. So keeps on monitoring the platelet of the patient. And as a nursing officer, who is as a eligible nursing officer in your aims, so you have to ask the every time patient goes to the washroom whether you have got any blood in the urine, whether you have got any blood in the stool. Okay, so and any bleeding from the natural orifice of the body. Okay, what is the natural orifice? from the nose is the natural hole. We can say the natural orifice. Okay, whether any bleeding from the nose, whether any bleeding from the mouth. So we have to ask for the bleeding from the natural orifice of the body. So there is the nursing officer, the eligible nursing officer who is fit to work in the AIMS. Okay, so you have to ask this question to the patient when you admit the patient with the dengue fever. Okay, so these are the classical pictures which will comes with the same word print in your question. So all you have to apply the concept from the master nursing classes and grab the answer as a correct and bring the best rank in the mains exam. Okay, so that is a master will get proud on you people, right? So yes, the next question is the next concept is that a travel history also will be there in the dengue fever patient. Okay, where there is the endemic countries will be there with the dengue. If the patient went there, so there is travel history also there. But okay, here in the typhoid fever, though no travel history required, just a history of the like contaminated food is there, means that is enough to diagnose the or typhoid fever. Okay, but in the dengue fever we must require, we will ask for the travel history because it is important, because the patient went for the endemic area, means from here he got the dengue. Okay, then in the typhoid and malaria there is no any retroorbital pain. Okay, so there is no any retroorbital pain. So that is what the retroorbital pain is, the differentiating feature and the classical feature which will be seen in the dengue fever. And all the very important point, additivity, the priority fluid management, dengue hemorrhagic fever prevention by IV fluid, this one, and very important by what the nurse should ask to the patient every time when the patient went to the washroom. That is the bleeding from the natural orifice. It's a very important. And the dengue fever is also known as the a bone breaking fever. So this is the extra years point. So consider one. Okay. So hope the thing is clear to you people on the dengue, right? So yes, is this clear? And one more extra point to take, that is the test we have to do, clinical test we have to do in the dengue fever is the, yes, the tourniquet test. Tourniquet test, we have to tie the tourniquet over the particular part of the body and we have to attach assess for the petaches. Okay, so there is the tourniquet test will be done in the dengue fever. Very important. So here is the next very important question to you people, that is the fever typically progresses through several phases. Okay, so there are the several phases of the fever is there. So which among the following is correct list of the three classical phases of the fever in order to sequence? Okay, in the sequence we have to assess the three classical phases of the fever. So I want the response from every one of you. So for do comment in the comment box. I'm waiting for your answers here, right? Very important questions. Yes, some of you have given the correct answer. That is the B. The onset phase is there, then the fastigium phase is there, and the difference phase is there. So this is enough for the RRB aspirants. Okay, so this much only will come in your RRB. But in the AIMS, what happens in the onset phase, what happens in the fastigium phase, what happens in the difference phase or the or decline phase, the question will come. So let me quickly revise the golden point for you people. Okay, there are the three classical phases of the fever is there. One is the onset phase, so we can say the chill phase. Okay, so onset phase is called as the chill phase. Okay, how you have to remember OC, that is the oral contraceptive. In the onset phase the excessive chills will be there, the excessive shivering will be there. Okay, so remember what, tell me one point, whether the shivering reduces the body temperature or the increases the body temperature. Yes, do response, whether shivering increases the body temperature or the decreases the body temperature. In the comment box write increase or the decrease, whether shivering increases or decreases. Very nice of you all. The shivering increases the body temperature. Sir, how, sir? If the patient is shivering, means the sweating will come, the body temperature will lose? No. Yes, that one your concept is right, but the thing is, the actual concept is this one. When the shivering happens, the muscles movement happens, means the one and another muscles rubs together. So because of that the body temperature will increases. Okay, so the shivering increases the body temperature. Okay, not decreases the body temperature. Shivering increases the body temperature. Very important point, remember. Okay, so the chill phase, that is the onset phase, we can say the shivering phase or the chill phase, most important. So that is the first phase. Then comes to the a second phase. In the first phase, fever will start to begin and chills, there is a shivering will be there. Okay, most important. Then comes to the second phase, there is the fastigium phase or the stadium phase. Okay, so where the fever will go to the peak and it will remain in the peak. Okay, so that is the fastigium phase. Okay, it will not comes to the back. Okay, it will maintain, fever will go till the peak and it will remains in the peak. Okay, so that is the stadium, means the static, means the constant. Okay, it increases and it will remain in the peak. That is the a Pasteurian phase. The question will come: the phases of the fever where the fever reaches its peak and which is static there. Okay, which is stadium there. Okay, so which in which phase of the fever the patient is there? Okay, the patient is there in the phase of the Pasteurian stage or the stadium stage or the peak stage. Okay, the peak or the sustained high temperature will there. Okay, continuously sustained means for a long period the patient is in the peak of the fever. Okay, so here the because of the excessive fever the skin is completely flushed and the body is completely a hot body and a high metabolic rate is there. So this is the high metabolic rate, flushed skin, hot body will be seen in which phase of the fever? There is the Pasteurian phase. Then comes to the deprivation phase or the decline phase where the fever start to decrease. Okay, where the fever start to decrease. So the fever will breaks and body temperature returns to the normal. Okay, there are two methods of there to decrease to the to comes to the normal. Oh, sorry. Okay, so just a second, please. Yes. So consider this is the onset phase, this is the Pasteurian phase and the stadium phase, and this is the decline phase. Okay, so in the decline phase, what I told, this one is the onset, this one is the Pasteurian, this one is the decline. Okay, so if a fever suddenly decreasing, okay, if fever suddenly decreasing, this one we call as in the crisis of the fever decreasing. Okay, crisis of the decline phase. Okay, if the fever decreasing step by step, this is what you call as the lysis. Okay, so suddenly fever decreasing, that is called as the crisis. A slowly fever decreasing, that is what you call as the lysis. Okay, in the crisis, two crises are there. One is the true crisis, another one is the false crisis. Okay, in the true crisis, body temperature suddenly decreases with all symptoms comes to normal. Okay, so all the symptoms will comes to normal and the body temperature also comes to normal. In the false crisis, only temperature decreases and all the body symptoms will remain same only. Okay, so that is what you call as the false crisis. Okay, so that is the very important words in the decline phase. So we are having the gradually decreasing, means that is the step by step decreasing, gradually decreasing, that is the lysis. Okay, so suddenly decreasing means that is the crisis. Okay, so in the crisis we are having the true crisis with all the body symptoms, the temperature also decreasing, that is the true crisis with only temperature is decreasing and all the body symptoms remaining in same only. So that is what you call as the false crisis. Hope the concept is clear on the crisis. Okay, so this is what a very important point to you people. So hope it is clear to you people. And here is the next very important questions. Yes, the question is very simple and most important. Okay, so a 35-year-old male patient with a sudden onset of the high fever, the suddenly high fever is there, accompanied by the intense chills is there, so dangerous chills is there, and rigor is there. There is a chills with the intense chills with the rigor. That is the shaking of the body is there. Okay. So he also complains of the muscle aches. Okay. The muscle pain is there. Headache is there. So which of the following is condition is commonly associated with rigor? Okay. So rigor is having the three phases. Okay. So where you will face the a cold stage, hot stage, and one more is shivering stage. Okay, so this hot stage, cold stage, shivering stage is coming means, okay, so this is what we call as in the classically seen in the patient with the malaria. Okay, so in the malaria the classically seen one is the our rigor. Okay, if the examiner asking the question related to rigor, so that is the sudden onset of the high fever with intense chill. Okay, so high fever is there, intense chills is there. Okay, with the complete rigor, that is the hot stage, cold stage, okay, and shivering stage. So in this one the malaria goes to the correct answer. Okay, differentiate between these all things. Okay, so hope this is the helpful to you people. Okay, so the next question is very important question. Consider a very important question. Bacho, the same question if not coming means the concept will not definitely strikes in your exam, and whatever the explanation of the particular questions I am giving to you people, that is going to be a very much helpful to you people in the mains exam, which is helpful for the eliminating the option and which is helpful for the choosing the correct options. Okay, so this is only a best strategy to crack your means exam. So that is what I am repeatedly telling to you people. Don't only do the MCQ for the means, a complete theory revision, fatafat fast theory revision with a high quality MCQs like what I'm teaching you people. This kind of the MCQs you have to practice. Okay, so here the one liner also it will cover. Okay, another all important scenario based, concept based questions, everything will be get covered in the this kind of the questions. Okay, don't have to worry, I will give my best shot from my side. So all you people have to work hard more than me, so as I told, to get a better best and Dengue rank. Okay, why? Because the competition is in its peak, competition in its peak, and every teacher working the hard and hardest. So that is yes, most of you have to work yourself hard and you have to sacrifice some things for the getting the better thing in your life. Okay, so the question is very simple. A 72-year-old man complains of the feeling he is feeling the dizzy. Okay, and he is feeling the lightheadedness when he stands up from the bed. Okay, so morning he suddenly stands up from the bed and now he is feeling the lightheadedness and now he is feeling the dizzy. Okay, and he mentioned that he is on the amlodipine tablet. Okay, and furosemide. Okay, so the amlodipine is the, yes, dipin, nifedipine, nicardipine, amlodipine, dipin is which class of the drugs? Dipin is the calcium channel blockers, and this furosemide, you people will call this one as in the last 6. Yes, this is the loop diuretic. Okay, the patient is on the diuretic, the patient is on the calcium channel blockers, and means the patient is on the antihypertensive therapy, and suddenly when the patient changes the position, he is feeling the lightheadedness and he is feeling the dizzy. On examination of the blood pressure, okay, in the lying down, his BP is the 132/80. Okay, in the standing position, his BP comes to the our 104/66, means a systolic blood pressure is decreasing more than 20 mm of Hg, and diastolic blood pressure is decreasing more than 10 mm of Hg after changing the position. Okay, in the lying down position, its in diastolic blood pressure is 80, and in the standing position, the diastolic blood pressure is 66. Okay, so in the lying down position, the systolic SBP is the 132. Okay, in the standing position, it's in 104. Okay, so this is how BP is changing. The SBP is changing more than 20 mm of Hg. The DBP is decreasing. That is the more than 10 mm of Hg. DBP also decreasing. Okay, so pulse is no significant changes. Okay, which of the following is the best definitive of the orthostatic hypotension? Okay, so these are all the criteria. That is the sudden change in the position, patient is on the antihypertensive therapies, which increases the risk of the orthostatic hypotension, and sudden changes which bringing the hypotensive symptoms, that is the dizziness and lightheadedness because of the less blood supply to the brain. Okay, after sudden changing the position, and the already clear they have given the diagnostic criteria also. In the lying down position, it's 132/80. In the standing position, the SBP also decreased, that is more than 20 mm of difference is decreased, and in the DBP more than 10 mm of difference is decreased. Okay, so pulse is no changes. So this is what we call as in the orthostatic hypotension. Okay, the diagnostic criteria of the orthostatic hypotension is the they have asked. Okay, so option E is that BP drops systolic more than 10 mm of Hg and diastolic more than 5 mm of Hg upon standing. Okay, no. So here the BP decreases more than 20 mm of Hg SBP and more than 10 mm of Hg DBP. So this is not our criteria. Then comes to the B, a drop in the systolic blood pressure, that is the more than 20 mm of Hg, and a drop in the diastolic blood pressure more than 10 mm of Hg. Very important, note the time, that is within 3 minutes of the standing. Okay, so patient is standing within 3 minutes, so he lying down, he stood up. Okay, so then within 3 minutes these changes are happening means, so this is the classical criteria of the, yes, to say it's an orthostatic hypotension. Okay, so that is the most important. Option B goes to the correct answer for this particular question. So remember the criteria. remember all the symptoms and associated risk factors. Okay, symptoms is the after starting dizzy, lightheadedness, and clinically scenario is the decrease in the BP more than SBP is decreasing more than 20 mmHg, DBP is decreasing more than the 10 mmHg within 3 minutes of the standing, and risk factors is the patient who is on the calcium channel blockers, then the diuretics and the antihypertensives are highest risk for the orthostatic hypotension. Okay, so this is what a very important. Okay, sometimes difficult questions will comes like this. As a base of that questions, the examiner will create a questions on the non-pharmacological measurements. So we can say this one is on the directly a nursing management of the orthostatic hypotension. It's a very important for the upcoming your RRB nursing superintendent exam and your nursing so Norcet mains exams. But to prevent the orthostatic hypotension, we have to give the all these particular very important suggestions to patient. Okay, so that is slowly change the position, and the most importantly we'll ask the patient to sit at edge of the bed by hanging the foot. Okay, for at least 1 full minute. Okay, so the patient is sleeping on the bed. We'll ask the patient to before standing up, we'll ask the patient to sit here. Okay, so we'll ask the patient to sit here for at least 1 full minute by hanging the feet, okay, below the bed like this. Okay, so this one will reduce us the risk of the orthostatic hypotension. Slow change in the position, sit before standing, okay, and stand up gradually, slowly. So this is a very important, and most important it will be. Okay, so it will strike in our exam. Then comes to the fluid we have to increase, then salt we have to increase, then compression strikings we have to give. So these are also interventions, but the most important one is the slow position change will be the most important. Okay, so hope it is clear to you people. Then comes to the next very important question, that is on the a type of the sleep apnea. Okay, so type of the sleep apnea. What is sleep apnea? When the patient will sleep, that time due to the central nervous system depression or due to the a mechanical obstruction of the airway, the breathing is stopping for the more than 20-second duration. So we call that one as in the sleep apnea. Okay, so what is the most common type of the sleep apnea? We are having here is the central sleep apnea, obstructive sleep apnea, then complex sleep apnea, then mixed sleep apnea. So among these, which one is the most common sleep apnea? The most common sleep apnea is the obstructive sleep apnea. Okay, so few of you have given the correct answer. So obstructive sleep apnea is the most common type of the sleep apnea. So what is the obstructive sleep apnea? Where the patient is sleeping, means because of the obesity. The most common risk factor for this obstructive sleep apnea is the obesity. Okay, the question will comes in your exam, bachcho. The most common risk factor for the obstructive sleep apnea is the obesity is the most common risk factor. Okay, and one more question, the most common risk factor for the type 2 diabetes, the most common risk factor for the type 2 diabetes mellitus is again the obesity is the most common risk factor for the type 2 diabetes mellitus. Okay, so here because of the obesity, the throat muscles if relaxes during the sleep, means the throat muscles closes, or maybe due to the tongue fallback. Okay, there is blockage of the airways there during the sleep. Okay, so mostly related to the mostly due to the relax of the our throat muscles, where it will block the airway during the sleep. Here we will see the excessive snoring sound because of the obstructed airway. Okay, so that is what we call the obstructive sleep apnea. But in the central sleep apnea, the airway is clear. There is no any obstruction because of the low signals from the brain to the respiratory system. Okay, where there is a chance of the absent of the breathing during the sleep. This central sleep apnea may happens in the patient with the CNS depressant drugs. Okay, so obstructive sleep apnea happens due to the obesity. Okay, so in the obstructive sleep apnea, the treatment of choice is the CPAP. Okay, CPAP, that is the continuous positive airway pressure we have to maintain. Okay, so continuous positive airway pressure we have to maintain in the obstructive sleep apnea, the most important. Okay, very important, bacho. So this CPAP is most important. The treatment of choice for the obstructive sleep apnea, the most common risk factor for the obstructive sleep apnea is the obesity, and the most common type of the obstructive sleep most common type of the sleep apnea is the obstructive sleep apnea. Okay, so the excessive snoring is there. The snoring is present in the obstructive sleep apnea, and in the central sleep apnea, the less signals will be there from the brain to the respiratory system. So the central sleep apnea, there is no obstruction in the airway, there is no snoring. Okay, so this is what most important, and here we are differentiating the type of the sleep apnea, that is the obstructive, central, and complex, or we can say the mixed. These both options are same. The complex and mixed are the same sleep apnea. Okay, total we are having the three type of the sleep apnea. Okay, here the obstructive sleep apnea, the cause is the blockage of the upper airway because of the relaxed throat muscles. Okay, so then a central nervous system, central sleep apnea, the cause is the brain doesn't sending the breathing signals to the respiratory system, that is the central sleep apnea. Bacho, here the obstruction is there, so that is what the snoring gurr, 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 gurr sound will come. Okay, so the snoring will be present in the obstructive sleep apnea. Okay, then comes to central sleep apnea, there is no any blockage, means there is no snoring. Okay, the examiner will throw the answer to the question through you people in the scenario based form. A sleep apnea without snoring, okay, without airway blockage, there is problem of the signals with the brain is there. Which kind of the sleep apnea? A very easy question, sir. The master nursing classes already taught us. That is the central sleep apnea. You have to choose the correct answer here. Okay, so then in the complex apnea or the mixed apnea, these both happening, so that is the combo of the this both. Okay, that is the obstructive sleep apnea, central sleep apnea. So the snoring will varies here. Okay, so the most important thing. Then comes to the, yes, in the obstructive sleep apnea, airway blockage is there. Yes, sir. Yes. So in the central sleep apnea, no airway blockage. Yes, sir. No. Then in the complex, there may be a present, there may not be a present. Okay, so the thing is very important. Okay, in the obstructive sleep apnea, brain signals are intact, brain is functioning normal. Okay, there is no brain signals issue. Okay, so it's an intact, there is no issue with the brain signals. But in the central sleep apnea, there is problem with the brain signals, and the mixed also there is a problem with the brain signals. Take a screenshot of this one, the type of the apnea and the differentiating feature. It's an most important to you people. And remember the risk factor of the obstructive sleep apnea, the question will comes from the obstructive sleep apnea only. Okay, remember the snoring is present, the airway blockage is present. Okay, so then there is no brain issue. The most importantly, the treatment of choice, the CPAP, and most importantly, most important risk factor is the obesity. Okay, hope the thing is clear to you people on the sleep apnea and its type. Okay, it is most important. And in the next video, we will discuss all other very important questions related to the apnea classification, hyperventilation, hypoventilation, and some very important, the confusing point is there. That is the what is hyperventilation and what is the Kusuma's breathing. That kind of the differentiation and study and to choose the correct answer. Okay, so after listening the tomorrow's class also, if you are able to fit, you will choose the answer like this. That is my promise. Okay, don't worry about the differentiating the things and making the things so different. And remember the things for the for long term to give you a best shot in the exam. So that is, I will teach with my style, that is the best style. So hope the style of the teaching and the content is very much helpful to you people. So if it's helpful to you people, don't forget to hit the like button. Okay, so, and yes, please try to mention some few words, that is the special words related to the master nursing classes. Thank you so much, beta. In the tomorrow's class also, we will discuss the very hot and high topics. Okay, so stay connected, stay motivated. Here I am not making a your single minute to get waste. I every your single second also I am utilizing to explain the thing to you. Okay, to grab the upcoming RRB nursing superintendent exam and upcoming Norcet 8 mains exams. Okay, so we will meet in the tomorrow session with very beautiful explanation again. So tab tak ke liye take care. Okay, take care of your health. Okay, so be cool, calm, relax, and don't wait for the till result. So start preparation. Okay, so if anyone of you want to join our WhatsApp group, the link is there in the description box. If anyone is, as I told, the fully planned series for the RRB and Norcet. Okay, so I have given the link in the description box and in the comment box. So if you want, we can join our test series also. We'll meet in the next class. तब तक के लिए जय हिंद, जय भारत. Take care.